Vaginal tears during childbirth. Vaginal tears are common during childbirth. They often happen when a baby's head is coming through the vaginal opening. These tears usually are a result of the head being too large for the vagina to stretch around, or the vagina doesn't stretch easily. Vaginal tears also are called perineal lacerations or perineal tears. Tears that involve only the skin around the vagina typically heal on their own within a few weeks. But some tears are more severe and need treatment. A member of your healthcare team examines you after your baby is born to see if you have a tear and, if so, whether it needs to be repaired. First-degree vaginal tears. First-degree tears are the least severe. They involve the skin between the vaginal opening and the rectum and the tissue directly beneath the skin. That area is called the perineum. First-degree tears also may happen around the tube that carries urine out of the body, called the urethra. First-degree tears usually cause some pain or stinging when you urinate. They may not require stitches, although some of them do. If a first-degree tear does need stitches, that repair typically can be done in the delivery room. These tears usually heal within several weeks. Second-degree vaginal tears. Second-degree tears involve skin and muscle in the area between the vaginal opening and the rectum. These tears may go deeper into the vagina. Second-degree tears typically require stitches. That often can be done in the delivery room. Healing usually takes about 3 to 4 weeks. Third-degree vaginal tears. Third-degree tears go into the muscle that surrounds the anus, called the anal sphincter. These tears sometimes need to be repaired in an operating room rather than in the delivery room. They typically take about 4 to 6 weeks to heal. If you have a third-degree tear, you may need to take antibiotic medicine to prevent an infection. After a third-degree vaginal tear is repaired, some problems that can happen include infection, separation of the repaired tear, leaking stool, also called fecal incontinence, and leaking urine, also called urinary incontinence. If you notice any of these problems, contact a member of your healthcare team. Fourth-degree vaginal tears. Fourth-degree vaginal tears are the most severe. They go through the anal sphincter and into the mucous membrane that lines the rectum. Fourth-degree tears usually need to be repaired in an operating room rather than in the delivery room. Sometimes they require more complex repair than stitches alone. Healing may take 4 to 6 weeks or more. If you have a fourth-degree tear, you may need to take antibiotic medicine to prevent an infection. After a fourth-degree vaginal tear is repaired, some problems that can happen include infection, separation of the repaired area, leaking stool, also called fecal incontinence, and leaking urine, also called urinary incontinence. If you notice any of these problems, contact a member of your healthcare team. How to ease discomfort while you're recovering. Sit on a pillow or padded ring. Cool the wound with an ice pack, or place a chilled witch hazel pad between a menstrual pad and the injured area. Use a squirt bottle to put warm water on the injured area as you urinate. Sit in a warm bath deep enough to cover just your buttocks and hips for 5 minutes. This is sometimes called a sitz bath. Some people find cool water more soothing than warm water. Take a pain reliever that you can buy without a prescription. If that's not enough to ease the pain, ask a member of your healthcare team about getting a numbing spray or cream to use on the injured area. A stool softener or laxative to prevent constipation may ease pressure and pain in the injured area. But talk to a member of your healthcare team before you start taking this medicine. Wait to have sex until after your tears are fully healed. Don't use a tampon or menstrual cup until after the tear has healed. When to contact your healthcare provider. Most people have a medical checkup 2 to 3 weeks after a baby is born and another about 6 weeks after a baby is born. If you have a vaginal tear, a member of your healthcare provider's checks on your recovery during these appointments. If more serious health problems develop due to a vaginal tear, you may need to see a specialist, such as a urogynecologist or a colorectal surgeon. Contact your healthcare provider right away if you have any of the following symptoms. They could mean that you have an infection, a separation of the repaired tear or other problems related to a vaginal tear such as 1. Severe pain. 2. Pain that gets worse. 3. Pain that won't go away. 4. Fever. 5. Leaking urine. 6. Leaking stool. What can I do to keep me from getting vaginal tears when I give birth? Vaginal tears can happen when a baby's head comes through the opening of the vagina during childbirth. They are also called perineal lacerations or perineal tears. These tears usually are repaired with stitches after birth to help healing. Vaginal tears may occur if the baby's head is too big for the vagina to stretch around. Or sometimes a tear might happen if the vagina doesn't stretch easily. Minor tears are most common. They only affect the skin around the vaginal opening. Severe tears may extend to the tissue and muscle around the anus. The practice of making a surgical cut near the vaginal opening at the time of delivery, called an episiotomy, is no longer done routinely. It's hard to completely prevent vaginal tears during childbirth, but some research suggests that the following steps could lower the risk of serious tears. 1. Keep the perineum warm. The area between the opening of the vagina and the anus is called the perineum. Placing a warm, damp cloth on this area during the pushing stage of labor may help the tissue stretch more easily. 2. Use perineal massage. During the pushing stage of labor, a member of your healthcare providers may place 2 fingers of a lubricated gloved hand just inside your vagina and move them from side to side. This is called perineal massage. It puts mild, downward pressure on that area and can help to stretch it. Doing perineal massage at home at the end of your 3rd trimester also may help the tissue stretch more easily during labor. 3. Control your pushing. Aim for controlled, consistent pushing. If you can, try not to push down hard all at once while the baby's head is coming through the vaginal opening. Pushing gently and slowly can give the tissue time to stretch. If you're concerned about vaginal tears during childbirth, talk to your healthcare practitioner. Ask what the healthcare team does to prevent vaginal tears. Talk about what you can do to help prepare for delivery and lower your risk of tears.